Hello and welcome to this special video. I had the honor today of keynoting the Integrative and Personalized Medicine Conference for my talk, which is entitled The Community Cure, Transforming Health Outcomes Together. I really hope you enjoy it. Enjoy.
James, welcome. James is a health economist, a Brit who has been living in the USA, but most importantly, has come to realize and now become quite a guru on real transformation in healthcare. If it's going to take place, you have to have a community approach. James.
Thank you so much. All right, well, 18 years ago, I lived about 5 minutes walk from here, and I lived in Westminster because I had to take the Jubilee line to Canary Wharf every day because I was an investment banker 1 year out of university, and I drank alcohol every day, and I ate about 90% processed foods, and that was my life at that moment. Now, luckily for me, and for you, and for us, drinking wasn't my only vice. I was also starting to dabble in psychedelics, and one night took what can only be described in retrospect as a heroic dose of MDMA, took myself off to Fabric nightclub, and over the next 8 hours, triangulated the following. One, as a spiritual man, I could no longer be an investment banker. Two, that my training in health economics brought an urgency to the fact that in my lifetime, whether it be the UK where I grew up or the US where I was born, we would all run out of money and time and effort under the weight of chronic disease. And third, that something in my weird childhood growing up in an intentional community and having homeopathy and chiropractic and energy healing, that something out of that world that I grew up in was where I need to spend my time. And just to give you a little, some details on that, you can see this in my training in health economics. We have essentially an exponential increase in the cost of medicine and healthcare, driven by chronic illness, right? That's the way that it's driven. And so the first question that I wanted to answer is chronic disease reversible? And I moved to America in 2005, and I want to show you why. Who in this room, put your hand up if you're in the business of reversing chronic disease in some way today? Almost everyone. Okay, keep your hand up if you were involved in doing that in 2005 every day. Right, just a few. So you can see it wasn't cool and sexy back in 2005. As Dr. Thompson said, there was a lot of resistance to it. But America embraces the wacky a little bit more. So I moved to America in 2005 to answer this question, is chronic disease reversible? So what's the first thing that we're going to look at? What is the standard of care? Medication. So this is from Nature, 2015. And if you get past the sort of pharma marketing bullshit of relative risk reduction, and you look at number needed to treat, which is really the only number you need to look at, these are the top 10 selling drugs in America by dollars, and you can see for every one person that the drug works for, black, it doesn't work for these. So you can see that goes from like 1 in 4 for Humira, which costs £5,000 a month, to 1 in 24 for Crestor, or 1 in 25 for Nexium. So clearly it's not drugs. If drugs were actually designed to reverse chronic disease anyway, which they're clearly not, right? So it's not drugs. So what is it? I came to functional medicine over a period of time, and the reason why is because what I recognized after 9 years of working in medicine, working in clinics and seeing is that, yes, integrative medicine is wonderful, and we talked about it here, but Dr. Thompson just shared, okay, you have these fully realized systems of medicine, naturopathic medicine, Ayurvedic medicine, and so forth, traditional Chinese medicine, but they don't use the same language. So how can you have a provider team work together if you don't speak the same language? And the reason why I landed on functional medicine is because you can see here at the bottom, it's got lifestyle medicine as a key part of it. It honors the mental, emotional, spiritual side of medicine, and it has the best shot, as far as I'm concerned, of having a common language for practitioner teams to rally around. And that's why I, after 9 years, came to the view that this was what I wanted to really support with my work. And so what did that turn into? It turned into the Functional Forum. Started as a meetup for doctors in New York who were interested in functional medicine. At one point in 2017, we had 400 meetups all across the world on 6 continents of doctors and practitioners just like you getting together to learn from each other and build coherence and resilience between you, because it's not easy to be in the world that you've been in for the last 15 years, because you can think you're crazy if you know that chronic disease is reversible and every other person in your profession doesn't believe it, doesn't think that it's possible because they're not doing it, right? And last night, we actually had the relaunch of the London Functional Forum, so we want to continue to build permanent local communities for practitioners to be together. We did the Evolution of Medicine Summit, 2016. I wrote the book, The Evolution of Medicine, and the goal of the book was, if I put it in the hands of a conventionally trained doctor, would they, after they read the book in 3 hours, want to jump ship and come and join, this community and practice in their own way? And, the perfect example of chronic disease being reversible, who remembers Doctor in the House, right? 5 million Britons watched it. There was 2 seasons. Dr. Rangan Chatterjee showed everyone that, yes, chronic disease is reversible. In the first season, relatively simple things like type 2 diabetes that could be reversed with diet. But the second season, they threw him cluster headaches and autoimmune disease, and every single patient got better on the show. It was an incredible example. But it also highlighted the inefficiency of the delivery. Like, from a resource perspective, having the UK's most highly paid doctor come and live on your sofa for 4 weeks in order to know enough about your life to help you reverse chronic illness, from an economist's point of view, this isn't going to get it done, right? So the next question that I've been looking at for the last 5 years is, can chronic disease be reversed at the scale that it exists? Right? Because ultimately what we really want, and now we all know this phrase, we're going to flatten the curve of chronic disease healthcare costs, right? We want to reduce the costs. We can't just keep going on an upward trajectory. We have to bend the costs, right? So this is the real question, right? Can chronic disease be reversed at the scale that it exists? And I'm here today to tell you that it is, and we're going to talk about how we do it. So this was the topic of my second book. It's called The Community Cure. You can actually get it for free if you go to thecommunitycure.com/audiobook. I retained the rights so I could give it away for free, because ultimately the goal is that every health professional, anyone in the world, could listen to it, get empowered by it. And in that book, there's a step-by-step guide to building what we're going to be talking about here today. This is my favorite quote. Shouting self-care at people who need community care is how we fail people. Nikita Valeria. Just take that in for a minute. All right, so as we've heard today a number of times, health or disease is bio-psycho-social in nature. One of the the shadow of the functional medicine movement, I would say, and also conventional medicine really, is that it's very biological focused, right? It could be, instead of drugs, it could be supplements. It could be, looking at the immune system and physical health and neurochemistry, but ultimately there are these big other areas that are really not addressed by the medical system and are what either creates disease or creates health. And if you look at this study, and these are all graphics from my book, you'll see that high social stress, loneliness mainly, is a bigger driver of all-cause mortality than smoking and alcohol, and actually than food. And yet how much of our public health dollars, public health money is put towards all these other things, and yet this is a bigger driver. The book was actually meant to be called A Cure for Loneliness, because that's what it does. But what I came to recognize is that if you cure loneliness in the right way, it can have all of these side benefits that we're going to talk about. And so the key part, the message of the book is this. If we want to really solve the plights of society, the best way to start is to solve loneliness using like an integrative lifestyle medicine structure and curriculum. The reason why we want to rebuild from healthcare as the starting point is that lonely people end up in the healthcare system anyway. And second, there is already budget assigned for helping people, right? So we have the NHS here, we have Medicare and Medicaid in the US, commercial insurance. There is there is budget to do things like a group medical visit. Look here on the right. So instead, on the left of seeing 8 diabetes patients one by one, we put them in a group. You have sort of a health coach or a link worker or someone doing some education, and then you have the doctor there in the top left corner fulfilling the criteria for the insurance billing or doing the personal work to see where people are. And that was my first introduction to group visits in 2013. Here's a question. If the greater attention from your health professional can induce a larger placebo response, what can the exquisite attention of 15 people do? Can we exponentially increase the power of the placebo effect by having groups of people listen to each other and connect to each other and give each other time? Now, you've heard a lot about link workers. The movement for social prescribing is actually further ahead here in England today than in the US. Everything's professionalized in the US. You can only get your grief counseling from a grief counselor because grandma's no good at that anymore. You can only get your babysitting from a babysitter because community has been ripped to shreds. But what I'm here to do today to put into your mind is actually the largest unlimited resource that we have access to that costs nothing and is being used to 0% of its potential is peer-to-peer, people supporting each other, right? And we're starting to get a taste of that with the link worker phenomenon, the social prescribing movement, but there's a lot more potential that we can find. Now, if you map groups onto the biopsychosocial model of health, what do you see? On an individual level, you get a lot of things that we need at scale: self-efficacy, self-regulation of emotions, mindfulness, engagement in life, self-monitoring, health-directed behavior, skills, not pills. I love the Pain Cafe. That was awesome. I'm so happy about that. I followed the work in Froome. I don't know if you guys have seen what they did in Froome, but this is at an individual level. These are all the things that we need to flatten the curve of healthcare costs. We need this at scale right now. But we also need these interpersonal benefits: empathy, social integration and support, interpersonal learning, affiliation with the clinician, altruism. A little bit of altruism never hurt anyone, right? At an organizational level, think of the NHS. What do we need? Efficient care, self-care, timely care, health navigation, peer-to-peer delivery of value. And at the community level, larger support network, community resources, resilience, and problem solving. This is all good. We need a lot of this quickly. All right, so this is the Personalized Medicine Conference, and you're going to hear over the next 3 days a lot about personalized medicine and individualized medicine to the individual. But from my perspective, personalized medicine is definitely the future. But for people who are disempowered, it's a fairy tale. And in the first chapter of my book, I talk about Dr. Jeffrey Geller, who essentially realized that, empowerment is the ability to make different choices. And this is where I'm talking about shouting self-care at people who need community care. If you have 4 kids, 3 jobs, and no car, right, you're not going to the yoga thing, right? You're not making it to all the wonderful ideas that you can dream up. And the thing that Jeffrey Geller said that was so critical is that he doesn't live in the same zip code and postcode as his patients who he's serving, and so he has no idea what it's like to be them. And so creating things from his mind of what he should do to solve the problem was not the plan, and that's why he built the empowerment model, which is essentially to just listen to the people in the room, find out what they need, and solve that. And you can hear about that all in the book. Jeff Geller is an incredible man. So what is personalized medicine? Personalized medicine can be an awesome AI technology computer that gives you an exact dose of supplements for your specific genetic makeup, but it can also be health coaching. Because ultimately, personalized medicine can be asking people what they want to do, what their goals are, and closing the gap between their intention and their action. That is personalized medicine. In fact, I would argue that is more personalized medicine than anything, because if they don't have that, they don't have anything. And I believe that health coaching is a critical component. 1, because you can train people up really fast. 2, because people who have reversed their chronic illness are ready to get into the workforce and have at it. And 3rd, I love this quote from Brené Brown: one day you will tell your story of what you overcame, and it will be someone else's survival guide. This is what I'm talking about, the peer-to-peer delivery of value, right? My mother-in-law lost 120 pounds going to Overeaters Anonymous. And the only thing that was different, she tried all the diets, the only thing that was different is that she had to speak to a peer and tell the peer what she had eaten that day, every day. That was the only thing that she had to do. And the desire not to be embarrassed by saying, I lost it and I went to McDonald's, right, was so powerful that it allowed her to lose 120 pounds. No money changed hands, no medical intervention, transformational moment. And so that's why I knew, like, this is what we have to harness if we want to flatten the curve of healthcare costs. So I wanted to try and come from all of the 18 years that I've spent in healthcare to find a unifying framework for how we can put medicine together. And this comes from naturopathic medicine. This is the Naturopathic Therapeutic Order. And what it essentially shows is that we need to start with the least costly, least invasive interventions first at the bottom and work our way up. So establishing the foundation of the health, dealing with the social determinants of health. That's that empowerment layer, right? Stimulating the self-healing mechanism. How do we do that? Sleeping well, taking care of ourselves in those basic ways. How do we do the next level? Support and restore weakened system. That's nutrition, right? All the way through this. Address physical alignment, natural symptom control, synthetic symptom control, and then high force interventions. If I simplify it, this is my version of it, it's this, right? At the top, we have surgery, then pharmaceuticals, functional medicine is in there somewhere, integrative therapies. And my thesis is essentially, the thesis of the book is that empowerment groups, modality groups, and nutrition groups can be the same group if they're run in the right way, and we can really rebuild medicine around groups for those three bottom layers. And ultimately, like, if you read the paper, Rishi Sunak says we need way more doctors. I would argue we might have enough prescribers already if we put them in their rightful place, which is at the top, right? What we need is to build out this bottom part. And you guys are the leaders in doing that. And ultimately, it doesn't cost a lot, and you don't need a lot more doctors. You need passionate people involved at the local level supporting their community. All right. Yeah, there you go. All right. You already had David Unwin as a case study today. I'll just say, and the stats are amazing. This was in the BMJ. You know, the percentage of people that have reversed their chronic disease in groups in his practice with his wife, right? The other thing that's amazing about it is the reduction in the use of pharmaceuticals. So this is his pharmaceutical spend just on the diabetes drugs compared to pharmacies in his area. But I would say as an economist, like, reducing the cost of the drugs for diabetes is just one part of the cost reduction that's happening, right? When you reduce someone's type 2 diabetes or reverse it, what about the anxiety drugs or the COPD drugs or the chronic kidney disease drugs? Never mind the overuse of the medical system, right? So there's a whole holistic benefits that come as a result of that. So we've seen David Unwin. And by the way, David Unwin was 2016 Innovator of the Year. It's 2023. Why hasn't this caught on? And I'm going to talk a little bit about that at the end. But David Unwin's an amazing example. You guys have probably seen the Cleveland Clinic Center for Functional Medicine. Incredible work over there. So in 2019, they show that functional medicine outperforms conventional medicine for a range of chronic diseases. And not just any conventional medicine, the Cleveland Clinic conventional medicine, right? The best in the world. And then this came out in April 2021. And this shows that group-delivered functional medicine outperforms one-on-one functional medicine. How is that possible when it's done by health coaches, dietitians, and a PA that's really just there for, de-prescribing? It's because the group is more powerful than the provider attention, right? The power of the group, people finding friendship, people working together to implement new healthy behaviors is an extremely powerful force, right? Better outcomes, not just lower cost. We could definitely understand the lower cost doing it in groups, but the outcomes are better as well. The third one, Dr. Cheng Rawn, is an awesome innovator in the US. I believe, so I was sitting next to Dr. Rawn in 2017 at a conference, and Dr. Woody Merrill was talking about the Continuum Center and why it had failed. And he was asked, if you could do the whole thing again, he had built a big integrative center at the Beth Israel Hospital in New York, or Mount Sinai actually. If you could do it again, what would you do? And first he said I would do it exactly the same. And then he came back at the end of the panel and he said, actually, if I could do it again, I would put health coaches in the center of the care delivery system, and I put doctors at the edges, rather than doctors in the middle and the coaches at the edges. And Dr. Rawn took this to heart, and ultimately you can see these numbers here. So during the pandemic, out of 3,288 patients, this is during the pandemic too, right? 56 have been hospitalized, so that's a 1.7% rate. If you had 5 or less coaching visits, 0.4 hospitalization rate. And for the people who have been in our groups together, 5 or more coaching visits, there were no hospitalizations. And these are the outcomes from the lifestyle, 6-month lifestyle groups that we've been running at Heal Community for the last 2 years. So you can see, when you put people into groups and you have them do the healthy behaviors together, right, this is what happens to health. Compare this to the numbers needed to treat earlier, right? And you can see what should be at the front of healthcare. What should be at the front of healthcare? Should it be drugs, or should it be groups of people working together to improve their healthy behaviors? So this is what we come back to in the group, what we come back to in the book as the thesis. And ultimately, anyone in this room can get into the business of, whether you work in the NHS or in private practice or otherwise, bringing together nutrition, modality, and empowerment into a group structure and scale it at the local level, whether it be in medicine or just in the community. Over the last, this is what I'm spending my time doing all day, every day. Ultimately, what I believe, there is a missing layer in healthcare. And that missing layer sits between patients and primary care. And that layer used to exist. It was grandma's wisdom. It was the community that supported each other. It was the larger social circle that has been ripped away from us, so that you get your food from the Uber Eats guy, and you get in an Uber, and you engage with a lot of faceless people that you don't know, and you know their community. Ultimately, we need to rebuild. My thesis is we rebuild healthcare and community. And so many people are already doing it in this room. So tomorrow I've got a workshop, and in that workshop we're going to be helping whoever you are actually in half an hour build your group program, whether you're in person, whether you want to do it virtually, whether you take cash, whether you're part of the NHS. We'll be helping people to do that. So just some top takeaways from today. Chronic disease reversal is not scalable as currently practiced. One-on-one doctor visits, long doctor visits in the way that it's being delivered. Social stress is a leading cause of disease and mortality. Group-based interventions have great outcomes at lower cost and are more scalable. Care can be personalized by the practitioner and by the patient, right? Personalized medicine can be patient-driven as well. People know they just need someone to be with them to get it out of them and hold them accountable to that next support. I believe that in 5 years' time, it will just be obvious that the standard of care for chronic disease reversal includes personalized medicine, but that the group care drives everything because it is economically feasible, viable, and I think that working together, we can flatten the curve of healthcare costs and have a more sustainable future for ourselves and our children. Thank you very much. So today at the conference, I shared my thesis for the transformation of healthcare by community. And one of the things I shared there is that Dr. David Unwin was 2016 Innovator of the Year for reversing type 2 diabetes in groups. But still, to this day, 7 years later, we don't have that at scale in the NHS. And the question we have to ask ourselves is why? And it's because if you do in-person groups, you are relying on local execution every place that you do the groups. I believe that in order for it to scale and to flatten the curve of healthcare costs, we need to scale group medicine to a completely different level. And scaling group medicine to a different level has to be done virtually, and for the following reasons. One is you can normalize, productize it all across all the clinics simultaneously. You could track all the outcomes, and most importantly, the patients can communicate with each other 24/7 inside the group. It's one thing to get them to connect once a week or every other week in person, if they can drive there, but to have 24/7 communication between the patients, that is the key to community, and that is the key to transformation. Hope you enjoyed the talk. If you're involved in the transformation of healthcare in the UK, send me a message. Let's be in touch. Thanks so much for tuning in. See you next time.